Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. As always, we're joined by my partner in crime, Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, as always, Conner Mertens from Seattle, Washington. He's my co-host and our patient advocate and community outreach manager at Global Healthy Living Foundation. He does an outstanding job working every day with patients to meet their needs, answer their questions. And Conner, you know the drill. We start off every episode with me giving you a number, and the number for this episode is 2000. And when I say 2000, what does that mean to you?
I don't know much about 2000, but I'm going to take a shot and tell you that 20 million is probably the amount of hearts broken when we found out Taylor Swift and Travis Kelce are starting to become an item.
You know what? I'll take the over on that one. To be honest with you, I think it was probably 200 million or something. But no, $2,000 is the cap that was implemented through the Inflation Reduction Act that applies for patients on Medicare Part D, so their prescription drug benefit program, which means that patients for the first time in the Medicare Part D have actually an out-of-pocket cap. That means they will not be required to spend more than that. And in fact, Conner, you know, one of the secrets was that Part D health benefit plan for prescription drugs was the only health benefit plan, either in the commercial insurance or even the government insurance, that did not have a cap until Inflation Reduction Act was passed.
So today we're going to be talking the Inflation Reduction Act, which is a topic we've covered before on this show and is covered last week on a really good episode of The Health Advocates, another great podcast in the GHLF podcast network. We're definitely going to dive in and get some updates on it, since there has been some updates since our last discussion. Robert, what are the big wins and misses for patients concerning the IRA?
So Conner, you know, with any large legislation, Inflation Reduction Act was a huge piece of legislation that passed last year. There's always benefits and risks for patients, and specifically when it comes to biopharmaceuticals. You know, the benefits, without a doubt, we just talked about it, the $2,000 annual cap that patients are going to have with regards to their out-of-pocket cost exposure. They're not going to be required to pay more than that. This is the first time that Part D, as I mentioned, has a cap for patients. The second part of the benefit is that, unlike other parts of the insurance model, whether it's commercial insurance or Part B, as in boy, Part D required patients or seniors to pay an out-of-pocket cost for vaccines. And because of the Inflation Reduction Act, that out-of-pocket cost is now zero. So just like other adult or kids that enjoy insurance through other government type of insurance plans or private insurance, seniors are not going to have to be paying anything out of pocket. And the third thing is really the insulin cap. And I know we've talked about this in one of our previous episodes when we talked about IRA, and the insulin cap of $35. Really, what has happened over the last year, we have talked about it in previous episodes, is that the three insulin manufacturers in the United States, Sanofi, Novo Nordisk, and Lilly, have decided that they're going to have a cap of $35 for all patients, not just Medicare patients, which the Inflation Reduction Act does. So in essence, what the IRA has done is taken what the manufacturers are going to do for everyone and codified it into law for seniors. And the risks, what's going to happen to patients? Well, I want to talk about what the Genentech CEO said, which is, you know, as a company, they've decided to delay a molecule that was intended for treatment of ovarian cancer. This is a drug that they're investigating and they're hoping to bring to the market and apply for FDA, evaluation. And they're going to delay it because ovarian cancer is not a large market, and they're going to see whether or not the drug actually works for lung cancer and prostate cancer, two of the larger cancers. And the reason being is because due to the Inflation Reduction Act, as soon as a drug gets approved by the FDA, the clock starts ticking with regards to the timeline that the government then can get into negotiation or set prices. And therefore, pharma companies are reluctant to bring out molecules or drugs that are for small populations. So it's going to hurt these patients who have rare diseases or ultra-rare diseases, because they want to see if these drugs work for larger patient populations, that they can sell more of it. And therefore, it's an unintended consequence of this law that it's going to have some negative effect for patients who are suffering because pharma companies, because of this law and the way it's set up, have to wait until to see if the drug works for larger populations before they bring it to the market. So that's been the major negative thing, is the impact on innovation and access to medicines for patients. But, as always, there are risks and benefits for patients.
Yeah, so it's something that we again discussed on our last episode regarding the Inflation Reduction Act was the unintended consequences that we see in R&D, the research and development of these drugs. So what are the other unintended consequences of the implementation of the Inflation Reduction Act?
So, a couple of things that actually we didn't really discuss on our episodes, and I'm not sure if we've discussed in any of our podcasts, is that one of the other things that Inflation Reduction Act did is that they capped how much insurance companies or pharmacy benefit management companies can increase the premiums. And because of that notion that they cannot increase premiums, because of the issue that now they have caps on how much they can charge patients, which is a good thing, both of those. And because they no longer, part of the benefit design was that they cannot pass the cost to the government that they used to for these super expensive patients. There's a possibility, it's a very good possibility, and it's probably going to happen, is that they're going to start ratcheting down the benefit itself. What does that mean for the average patient? Is that you may see more step therapy and prior authorization and even removal of drugs, like exclusion of drugs from formularies, because the incentive is going to be for them to really ratchet down the benefit because they're not going to be able to either pass the cost to the government, they can't charge the patients anymore, and they can't increase the premiums, which are three great things for patients, but that's another unintended consequence that you can basically foresee coming.
Yeah, I mean, step therapy and formulary exclusions are certainly topics that we've covered extensively as well, and the consequences that have on patient care and their health overall. Robert, what are the good parts of the IRA? How is this helping patients?
Well, definitely, the cap, the annual cap, the vaccine zeroing out, and also the insulin cap that is going to be codified into law. One other thing that has come up, Connor, we talk about what's new, is that 2 weeks ago, CMS, Center for Medicare and Medicaid Services, published the initial list of drugs to be negotiated. And there were some surprises, actually, in that list, and we should discuss that and put our take into it.
Definitely. That was something that we didn't have the last time we discussed the Inflation Reduction Act, was this list of medications that CMS was going to release. So what are your thoughts on it? Is it a good list, bad list, ugly list? What are we thinking?
I think it's a 50-50. To be honest with you, there are some not so surprises on the list of drugs that are going to be negotiated or price set by the government. These are expensive medicines that are being sold to many patients, and they're high-cost spending drugs for Medicare. But it was interesting that they also put in 4 drugs on the list, 3 of them being small molecules that actually lose their patent life prior to the publication of the date of the price, which is going to be January 1, 2026, which sort of doesn't make sense because this. As soon as products lose their patent and generic molecules, especially small molecules, are introduced in the market, not like biosimilars, the market collapses and these prices of these drugs bottom out, 80-90% reduction. So it was interesting to see that there were 3 small molecules that are going to lose their patents prior to the enforcement of the price on January 1, 2026 that are going to be going off patent. So in essence, it doesn't make sense what they're on the list. The 4th medicine actually is a biologic, Stelara, that already has a biosimilar that's been approved by the Food and Drug Administration, and it's supposed to come out in 2025. So again, this drug is going to have competition. So again, it doesn't make sense because remember, the premise of this law was that we're going to look at drugs that have no generic competition, that they don't have any biosimilar competition, and we're going to basically start price setting them. And in essence, the initial list release sort of violates the essence of what this law was supposed to be doing. So those were the surprises to me. And then the other thing, Connor, they did bypass a couple of oncology drugs that are high-cost medicines that should have been included on the list, and that was surprising in a way that they didn't include them. Now, you could think about it that they perhaps wanted to bypass oncology medicines, but that's not the case because a couple of other oncology medicines were included on the list.
So we talked about the benefits and the risks for patients with this IRA, but what are the biggest misses? How does this just flat out come up short?
Connor, we've talked about this on multiple episodes. The biggest issue with the way that the market is for pharmaceuticals, the way that PBMs and insurers sort of take advantage or scheme the market is that when drugs are negotiated and there's significant rebates and concessions given by pharma companies, none of those rebates and concessions get passed back to the patient at the pharmacy counter. That means when you and I and Ben, our producer, or anyone else shows up to the pharmacy and picks up a medicine, if that medicine has been negotiated, the price of that medicine has been negotiated to be significantly lower than what the retail price of that medicine is, we don't get to benefit from that. So if we have a coinsurance or deductible, we have to pay these inflated retail prices instead of the significantly lower negotiated prices that can be about 40, 50, 60, 70% less than the retail price. And that was the biggest miss. They could have done it. They didn't do it. Patients would have significantly saved money at the pharmacy counter. And I have to say, I blame both the previous administration and the current administration that they have not addressed this issue. Pharmaceuticals are the only benefit in the healthcare marketplace, and our listeners have heard me say this multiple times. It's the only benefit in the marketplace when a patient shows up and has a deductible or coinsurance. They're paying that deductible or coinsurance based on an inflated retail price instead of negotiated price. In every other segment of the healthcare system, we know that Ben is having some dental issues. When he shows up to his dentist's office based on the negotiated, he pays his deductible or coinsurance based on a negotiated price. That doesn't happen in the pharmaceuticals. Somehow PBMs and insurers have bamboozled the government and the employers, and both administrations have dropped the ball and are not helping out patients at the pharmacy counter.
Well, as always, thanks for breaking that down for us, Robert. I know that this is going to be a continually evolving issue and topic that we'll keep everyone and our listeners up to date on, because it is ever changing and it is important. It impacts folks' lives daily in the healthcare system. I really take away from this is obviously there's some good and some bad, but we really should be concerned about things like research and development and the production of emerging treatments and therapies that could be impacted by the Inflation Reduction Act. Just my 2 cents, but you know how it goes around here, Robert. We'll make sure you get the last word. What do you think?
No, your 2 cents are really good 2 cents, actually. And I have to say, whether you believe Congressional Budget Office or you believe any of the private analysis that has been done, Inflation Reduction Act will have a negative impact on innovation in this country. The answer to that question has been answered, both by the government agencies as well as private consulting firms. Now, the issue is to what extent, and how does this impact our patients in Global Healthy Living Foundation and otherwise that really need these innovative medicines? And that's to be seen. It's an unknown, and we will see this law play out for the next few years as we go through the process. But Conner, you deal with our patient every day. And I know the first and foremost thing on their mind is there hope for me to be able to either cure or manage my illness? And is that in the current model? Do we have anything currently, or is it in the future? And the future is the one that looks really murky at this time.
Well, thanks for breaking that down for us, Robert. I think there's definitely some valuable information in there for all of our listeners. And to our listeners, don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening, so you'll never miss an episode. And if you have a second, help spread the word by rating our podcast, writing one of those positive reviews, and sharing it with your friends and family. It'll help people like you find us.
If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. And we're always looking for new material, new questions. In fact, Conner, our podcast with Shilpa, last time we did it regarding her journey about getting her vaccine, has gotten a tremendous amount of feedback in social media. A lot of people have sort of empathized with what she has gone through. And how that came about is that, we got a note from Shilpa that said, this is what happened to me, and we invited her to come on the podcast. So please send us your thoughts, and if we see something compelling, we will definitely discuss it, but we may even have you come on board and talk to us about it. So please do contact us.
And before you go, make sure to take a listen to some of our other great podcasts on the GHLF Podcast Network, like The Health Advocates, which covers the IRA in their last episode. You can find all of GHLF's podcasts at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's my good friend, Conner Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.